Hello everyone and welcome to another audio podcast in this series, the Excerpts, the Excerpts Equipoise chapter. This is the Shientist and this is another Storm Robotics production. Today I'm going to provide an excerpt around a review of COVID-19 pathology and the analysis of approaches to easing kidney disease burden, a take on host pathogen communication and visualization. The excerpt around this includes where the introduction, the novel SARS-CoV-2, despite affecting the upper respiratory tract, can also target the kidneys, resulting in disease burden. In the lack of effective treatment for COVID-19, a more indirect approach should be considered to lower the toxicity of the disease among vulnerable patients. The aims around this work was that the work seeks to investigate causes and potential mechanisms during SARS, in and around SARS infection, CoV-2, and the kidney, and the effects of haematuria, proteinuria, and acute kidney injury. The objectives of this work is where the work seeks to understand or provide an understanding of microscopy and visualization of host pathogen communication and principles of immunology and infection to understand burden of kidney disease. Now, the design around this works is the core focus of the works would be to provide basic principles of viral activity within the kidney and the analysis of the effect of immunology and pathological components, which are important in the treatment and prevention of viral disease and infection, including COVID-19. The discussion around this is that there are suggested theories surrounding mechanisms of COVID-19 as part of the immune response to pathogen. There is also an implied possible beneficial effect to improve immunity against viral infection. The conclusion around this is that molecular signals may provide appropriate strategies for the management of COVID-19 in most patients according to immune response, and can be achieved through microscopy and visualization of host pathogen. The acknowledgement around this is to Pison, and wherein there was a collaborative effort between an academic institution and the Renal Patient Support Group, the RPSG. And once again, the excerpt around this was a review of COVID-19 pathology and analysis of approaches to easing the kidney disease burden, take on host pathogen communication and visualization.